Mount Sinai Beth Israel Hospital in Manhattan will close to rebuild smaller. Mount Sinai Beth Israel, an 825-bed hospital that has served downtown Manhattan for more than 125 years, will close and be replaced by a much smaller building, hospital officials said on Wednesday. Mount Sinai Health System, which runs Beth Israel and 6 other hospital campuses in the New York City area, said that it would be 4 years before the hospital closed and that its primary specialties, behavioral and outpatient surgery services, would be expanded over that time. The move adds Beth Israel to a list of 19 other hospitals in the city that have either closed or overhauled how they operate since 2000, a reduction in services that has hit Lower Manhattan especially hard. The decision also reflects broader trends at a time when hospitals across the country are struggling financially. At its core, healthcare was just too costly, said Dr. Kenneth L. Davis, President and Chief Executive of the Mount Sinai Health System. We have the macroeconomics of healthcare, which is that it is unaffordable for everyone, Dr. Davis said in an interview on Wednesday. Beth Israel, he said, stood to lose $2 billion in the next 10 years because of changes in federal reimbursement structures alone. Last year, the hospital had an operating loss of $115 million. Dr. Davis said large hospitals were also no longer the most efficient vehicles for delivering care, in part because of medical advances. Not long ago, for instance, surgery to replace a hip or a knee would require a long hospital stay. A patient undergoing such a procedure now can often go home the same day. The plan for the new Beth Israel building calls for breaking ground in 2017. Once that is completed, the existing building, at 16th Street and 1st Avenue, will be sold, with the proceeds helping to offset the costs of the change, hospital officials said. The new building will have about 70 beds with an emergency department several blocks away, officials said. It will also include expanded outpatient facilities at 3 sites with more than 35 operating and procedure rooms and 16 physician practice locations to be used by over 600 doctors. The Mount Sinai system, the largest private employer in the city, said in a statement that it would invest $500 million in changing the way it delivered health care and that it was committed to retraining and placing as many of its current employees as possible elsewhere in the system. Dr. Davis said every union job had been guaranteed.